Here's what no one told me during orientation. Delegation isn't just about getting help, and it is certainly not about dumping tasks on your coworkers, but it is about protecting your patients and your license. If you don't know the 5 rights of delegation, then you may already be making risky calls. When it comes to delegation and teaching that skill, all of my new grads are very uncomfortable because number one, they still feel like they're learning and they want to do the task to support their learning. But number two, they don't feel like they've earned the right to be able to delegate. And here's the thing about that mindset, it can be very dangerous and it can set up a new nurse to get so far behind that it puts your license and your patients in danger. So I'm here to share with you 6 tips on how and when to delegate so that your patients are protected, you are protected, and you're leveraging the staff that they hired to support you with those tasks. So tip number 1, do you even know what can be delegated? I was talking with one of my new nurses and I was like, okay, I'm here to help you. What do you want me to do? And she's like, I have no idea. And I was like, okay, think about it from a perspective of there are only certain tasks that only the nurse can do. So, what are those tasks that only a nurse can do that nobody else in the department can do? And she started really thinking about it. And she came up with a really great list, actually. She came up with assessments. She came up with giving IV medications and pushes. And she came up with some of the charting aspects, which was great, but it wasn't complete. Also, nurses are the only ones that can do patient teaching. So think of it from a standpoint of yourself as the nurse. And there are things that only a nurse can do, right? Assessments, teaching, IV pushes, and specific charting. So don't forget when it comes to those things, if you're running behind on those things because you're running around doing all of the things that you can be delegating, you're not staying in your lane and doing your job. You're trying to be a superhero or you're trying to prove yourself or you're just working too hard in general. Okay. So know what can be delegated and what cannot. There are things that only a nurse can do that can never be delegated. Pretty much everything else, like getting repeat vital signs, getting the patient a warm blanket, helping with hygiene, doing a Q2-hour turn, doing a glucose check, get a warm blanket. All of those things can be done by somebody else who is there to support you while you catch up on the things that only you can do.